With all the confusing information about healthcare, it's so easy to get frustrated and confused about what exactly is out there. Well, there is a new law now which is intended to end health insurance discrimination against those seeking treatment for mental health and substance use disorders. It is called the Mental Health Parity Act. And here with more insight on the Mental Health Parity Law is Dr. Greg Greenwood, the CEO of Human Capital Specialist, coming all the way to us from San Diego, so we sure appreciate this. Obviously, a very important topic. Welcome to the show, Dr. Greg. It's good to see you.
Thank you, Alex.
You say you want to make a splash in the area of healthcare reform. How do you want to do that? How do you intend on doing that?
Well, really, to go about having behavioral health become more a part of people's overall health care treatment. It is not, at present, as completely treated as we would like, and the Mental Health Parity Act is going to allow and open a lot of doors to have behavioral health addressed more comprehensively, which actually will lower the cost of health care overall.
So right now, mental health issues are not addressed in your regular insurance. Is that what we're talking about?
They don't have equality, if you will, or parity, as it's called, with your physical health benefits.
Okay, so they're not included, I guess you could say. Okay.
Correct.
So tell me a little bit about Human Capital Specialists and how you hope to get the word out there to people, and how is this really going to benefit many, many people?
Yeah. Well, Human Capital Specialists is a company that consults with the healthcare industry. It's made up of psychiatrists, clinical psychologists, which I am, and other mental health professionals, and we consult with the healthcare industry about how to integrate behavioral health with their physical health so that the complete individual is being treated and things aren't done piecemeal.
A lot of people think, well, I don't have mental issues. This is not a problem for me. But talk to us about some of the disorders. What could they be? And we've come to find out that a lot of people really do suffer from some sort of disorder, maybe whether it be depression or even post-traumatic stress disorder, which a lot of military men suffer from. Let's talk about what those could be.
Okay. Well, in fact, 26% of the population of the United States at any one given year suffers from a mental health issue. Major depression is a large component of that, and it is experienced by 14.8% of the population. And half of those are untreated. So half of the people that are experiencing major depression are not getting treatment. And even those that are getting treatment, there are a lot of them that are not getting adequate treatment.
Because they don't know what's out there.
That's correct.
And that's what you're here to let them know.
That's correct.
And what about a lot of our military men who come back and suffer from these disorders as well? Would they be included? Would this also be a disorder?
Absolutely. In fact, 19% of the Vietnam veterans returning home were diagnosed with post-traumatic stress disorder. You probably heard a lot about post-traumatic stress disorder, but the military in particular is experiencing right now an increase in suicides and really having a lot of mental health issues because of the multiple deployments that people are going through.
How will your company help people understand and take advantage of the Parity Act then?
Our goal through my company is to educate health plans about how parity can be helpful as opposed to not something to be concerned about or feared as having runaway costs.
Yeah. So that way people will know what's out there and how they can take advantage of it. I know you have a website, and can you tell people what it is? There it is right there on the screen.
Yep. It's hcspecialists.com.
Okay, and they can go there and get more information and get many more questions answered?
Absolutely.
Okay, about their health care and the new Parity Act, which is so important. I think that people really need to take advantage of it. Thank you so much for being here, Dr. Greg, especially for making the drive for flying, I should say. Yeah, you corrected me. I actually flew. Thank you so much. We appreciate it. It was nice to meet you.
Thank you, Alex.